So my talk today here is effective communication with parents. And as pediatric ophthalmologists, most of our time is spent in counseling. And parents being a very important caregiver for the child, they are equal or more partners in patient care. Slide. Now, this is just to touch upon why and why is all this discussion so important. Like we have already seen, myopia is a rising problem by 2050. More than 50% of the world population is going to be myopes. And this is a very important paper by Dr. Rohit Saxena and group, which showed that there was a high percentage of myopia, especially in urban India compared to the rural India. And why are we worried? Of course, we all know all the complications that can be associated with high myopia. But do we counsel this to our parents? No. So, this was an extensive study done in Ireland where they saw what is the parental attitude if the child gets myopia. Now, most of these parents saw it as an optical inconvenience, a higher expense, or a cosmetic inconvenience. And they found they was very nonchalant about myopia as a health risk. This means the education is still lacking. But it's all about love. I don't think the parent doesn't love the child. They're just not aware of what to worry about and when. So, first of all, when a child comes to you and the parents are sitting right across you, let them digest the news. For a first time parent to have a child wearing glasses at say 4 or 5 years of age is quite a big news. And so letting them digest and not wanting to counsel somebody who does not require counseling at that time is very important. Another important is when, where, whom to counsel. Now, many a times we see in our clinics that all these children come with like multi-generational, like there'll be some aunt, uncle, there'll be parents, there'll be grandparents. So there'll be 6, 7 relatives. Now, you are not going to be sitting with all of them and telling all the information. So find out who are the primary caregivers for this child. Sometimes a parent is staying in the village with the grandparents and they might be much more important chain in the management of this child. Also, I think give them time. If you feel that everybody is quite hurried today, then do not do the counseling. Call them again to further counsel about myopia. So this is something that I do. Keep the child engaged. The child doesn't need to know too much right now. So keep the child out of your outpatient. Once your checkup is done, let the child play, read books while you have your staff babysitting them, then counsel the parents inside, because then they can really concentrate. Effective communication, what is important is it has to be first sincere. You can't put in so much fear. You can't say your child will have a retinal detachment, so let's do something. Have long-term discussion. Tell them that this is how things are going to go, but keep short-term goals. Now, for a person who has a child 5-year-old, to envision what will happen at 20 becomes too much for them. So have 3-month goal. Okay, this is what we want to do. Maybe 3-month follow-up. This is how we'll follow up, and have that kind of communication and important discussion. First of all, tell them how they got there. So if they know that this child was already at a higher risk of getting myopia because of the parental history or the ethnicity or excessive near work or limited outdoor time, they know where to start making the changes. And educate them that what is progressive myopia, and tell them what makes this child more likely to progress. So then the parent actually knows, okay, where should we start? And as Dr. Jethani said, define the disease. Now, whenever you're talking to the parents, let us define what do you mean by myopia progression? What amount of axial length monitoring are we talking about? So they know, again, what they have to see too when they come for your visits. Another important thing is to recognize which parent is in denial. Now, all of us, when we see this we see both the couple actually crumbling. You see the father blaming the mother, mother blaming the father, and there is a completely different game happening there in front of you. And that is when you stop. You think, do not counsel today. Let this news digest. Give them another appointment to come without the child, and then maybe go ahead for your parental counseling. So identifying where not to counsel is also important. This is very important in our practices, especially in Indian families where there is, you can't just say it is because mother is myope or father is myope that the child got myopia. This ends up in our urban households that we are seeing. It ends up at a very big fight there inside the house, and the real problem of this child having myopia is aside. So always bring this, that it is nature and nurture. It is like diabetes, where the Asian population is anyways at higher risk, and then these are the reasons, so that there is a positive outlook to what we are looking at. Avoid these scare tactics. I have seen, it's like, in the, like how some hospitals, what we see for cataract counseling, where they say that this is bad cataract, tomorrow it has to be operated. So many a times myopia counseling ends up with these words like blindness, irreversible, we can't do anything. Please avoid these words completely. There is no need for scare tactics. Do not give so much of deluge of information when you are talking to parents about myopia. Let's go stepwise. So like I said, let's define myopia for them. Let's define progressive myopia. Let's do what is the risk assessment for this particular child, and how we can help in making tailor-made approach for that particular child. Now, this is very important. In as a parent, we always want to do something ourselves. So tell them this is your do-it-yourself thing that you can do easily at home. Let the child get outdoors, adjust the reading habits, have better sleep for the child. So this is something where the mother or the father feels that they are actually doing something to change the myopia. So DIY is really good. These are terms that our families really like. At home remedies. What can I do from home? So like every mother in your clinic would be asking you about food. Actually tell them what they can be fed to the child. And some mothers go to the extent of saying, can I have a diet chart? So just give them something. See, it's not going to harm or really kind of change anything main, but for a parent to feel that, oh, I am feeding the right food for this child is actually very important. So go with this. Do not go directly into DIMS, HALT, atropine. Go for these basic things first so that the parent is with you. Practical tips. Now, this is at my own clinic where you see so many toys I have, but this child is with the phone. And so this is what is happening even at homes. So give them practical tips which you do with your own children. How you can set gadget guidelines, how you can have screen timeout, how you can lock your devices, how the parents can mirror good habits and have good family time outdoors so that the child doesn't get stuck with the gadget. Then you come to your science. So what you can do and all things that you can offer, and how you are going to make this tailor-made for that particular child. So the parent feels that, okay, it is case-based, which is the truth. So you are not a salesperson. You are not here to sell those glasses. So remind yourself of that you are a pediatric ophthalmologist who wants to make a change. And let's always stock data. Let's not talk like a homeopath or an Ayurveda doctor where we are saying everything. Let us talk data. 20% improvement, 40% improvement with this over a period of time, what your studies are showing. Let's share that with our parents. And sell your skills. Like Dr. Jethani was saying, we already do this fantastically. You are going to, so sell these skills, tell them all these things like Dr. Shruti had shown, document it. What are you doing? How are you following up? This is again a very useful tool that I use. This is a BHVI has a lot of info available online, and this is a myopia calculator. So that particular age group of a child, if you enter this data, you will find that, okay, the progression can happen. So this data just shows you for a 12-year-old child who is starting at minus 1.5, at 17-year-old, he might get minus 3.6. So they have a prediction of how much this myopia will progress if you do nothing. And this helps your parent understand, okay, this is what we are looking at. Again, another tool is Ocumetra, again very similar, where you enter all these findings, you enter your axial length, and you get, so this is like, how does the patient myopia compare, how does the patient see the world. So this is again freely available, and you can use this. So this is how it is shown, where you will see the myopia and you will see, okay, this is how your child sees. So what are your options? Low dose atropine, bring in the ATOM2 study, give them a printed document, to take consents for what you are doing. This is again very important. Talk about how important it is to be consistent, and good parent motivation is very important. Some parents on the first go, they will tell you, because the child would have had a cycloplegic dilatation already before you saw. So they will say, no, I think putting drops is going to be very painful. So acknowledge that. Do not pressurize saying, okay, no, only this will work. Because you know the problem, if the parent is not going to accept that, the whole therapy is never going to work. If the patient has accommodation lag, so you need to document this, and you need to tell them that, okay, your options are now limited. You are going to be given either bifocal glasses or progressive glasses or multifocal contact lenses. See if the parent is okay with a contact lens being put instead of a glass. Then you can also teaching them, what are we thinking about, what is this hyperopic defocus that we are talking about. With some models you can actually go ahead and teach that, and then advise about glasses, like Dr. Shruti was saying. I also keep the model of these glasses in the hospital. So this is again another problem. From 4 years of age, the parent will be asking every visit, when can I do LASIK, when can I do LASIK, when can I do LASIK. Do not lose your cool. Tell them again to aim short term, and which will help. Do not stop treatment is something that we all need to tell them. And provide take-home information. Now, take-home information in today's world, if you give them pamphlets, they're going to be thrown right in the dustbin outside your clinic OPD. So video, or like Dr. Shruti has creating a WhatsApp group of these parents, making your connect with the parent much closer with your YouTube channel, Instagram, or your social media handles, is going to really help them win, and then we all win. Thank you.